This presentation summarises the findings of the JSNA Wakefield Children's Annual Report, focusing on those aged 0 to 17 years living in Wakefield District. The Joint Strategic Needs Assessment, usually shortened to the JSNA, is a continuous process by which local health and wellbeing boards across England assess the current and future healthcare and wellbeing needs of the local population to inform decision making. Wakefield's Health and Wellbeing Board members include representatives of Wakefield Council, local healthcare and other organisations such as police and housing, whose work contributes to people's wellbeing in Wakefield. Information that makes up the JSNA is available through the Wakefield JSNA website. It includes data on health conditions affecting the Wakefield population and factors which can influence health. These include deprivation, housing, smoking and education, and highlights where there may be inequalities for some groups. It also includes information from two major population health surveys, the Adult Health and the School Health Survey in the district. Each year the JSNA annual reports, one for adults and one for children, provide an opportunity to focus on the most pressing health needs in Wakefield district. This report summarises the findings where further investigation may be needed. It highlights the local population, district characteristics, health protective characteristics, population groups who may have greater needs and health protection. A PDF copy of this report is available on the JSNA website for further reading. The copy of the report on the website includes interactive links. Just click on the More Info text to be taken to web pages with more detailed information. Within the report, the comparison is made between the picture in Wakefield and other areas, including national and regional figures. Colour coding is used to show whether Wakefield is worse, in line or better than the comparator. Across the district there are 75,000 children, about 1 in 5 of the population. In the next 10 years this is expected to increase by 7,000. There are about 3,900 births to Wakefield mums each year. The birth rate has been declining over the last few years. School pupils in Wakefield are more likely to be of white British ethnicity compared to nationally. People in Wakefield are not expected to live as long as children born in other areas of the country. Both males and females have lower life expectancy than the England average. Further context to the JSNA annual reports can be found in the State of the District report. This report gives more information about the people and places in Wakefield, including living environment, economy, housing and education. The next section highlights some of the areas of health that are important to consider in Wakefield District that affect children. A child's early years can have a major influence in their future health and well-being. 3 in 10 pregnant women in Wakefield are living with obesity, and 14% are smoking at the time of delivery, though this has seen a major reduction over the last 10 years. Breastfeeding can help improve the health of mums and babies in the short and long term. Breastfeeding rates are lower in Wakefield compared to nationally. Living with overweight and obesity can have long-term effects on a child's health. The National Child Measurement Programme is a government scheme to understand childhood weight patterns and trends. Children living with overweight and obesity are at higher risk of adult obesity and related health problems such as high blood pressure, type 2 diabetes and cardiovascular disease. The percentage of children living with overweight and obesity was higher in Wakefield than nationally, in both younger and older children. Children living in the most deprived areas were more likely to be living with overweight and obesity. Older children were more likely to be living with obesity if they were living with overweight and obesity when they were younger. Asthma is the most common long-term medical condition in the UK. Hospital admissions for asthma in Wakefield were similar to regional and national rates. Smoking and poor air quality can both lead to an increase in hospital admissions for asthma. A quarter of pupils reported someone smoking in their home, and in Year 9, 13% had tried smoking and 29% had tried vaping. Mental health is as important to a child's well-being as physical health. In the 2022 School Health Survey, 1 in 10 pupils in Year 7 and 9 had a low mental well-being score, and girls were more likely to have a low score than boys. Hospital admissions related to mental health were lower in Wakefield compared to national and regional averages. These lower rates could be due to local health initiatives related to child and adolescent mental health. Poor oral health can have a major impact on a child's overall well-being, including their ability to eat, sleep or concentrate at school. Hospital admission for tooth decay is higher in Wakefield than regional and national rates, but has been falling in recent years. 6 in 10 children have been seen by a dentist in the last 12 months, and a high percentage brush their teeth at least twice a day. There are several protective characteristics that act to improve a child's health. These include safety and well-being, diet and fitness, and education. The School Health Survey gives us a lot of information about the well-being of children in years 5, 7 and 9 in Wakefield District. More than 6 out of 10 children in year 5 felt happy with life, though percentages were lower in 2022 than previous surveys, possibly due to the effects of the COVID pandemic. There were gender differences, with girls more likely to be lonely and less likely to be happy than boys. A good night's sleep is important for a child's learning and development. Just over half of the children in the School Health Survey had 8 or more hours of sleep a night. The percentage of children getting this amount of sleep decreased as children got older. 7 in 10 pupils in the School Health Survey felt safe in the area they lived. Less than half of 5 to 16-year-olds in Wakefield meet the government recommendations for physical activity. This is similar to regional and national levels. The School Health Survey is an excellent source of further information about diet and activity in children in the district. It included insights into the barriers children reported to doing more activity, including worries about looking silly, not having time, and not feeling bothered. Education is an important part of children's lives, and over 2/3 of children aged 4 to 5 in Wakefield achieved a good level of development, similar to national and higher than regional levels. Attainment when children were 15 to 16 years old was the same as regional and national levels. Levels of 16 to 17-year-olds not in employment, education or training is lower than the regional and national average. Since the COVID pandemic, school absence rates have increased nationally and in Wakefield, with 1 in 5 pupils missing 10% or more of their schooling in the 2022-23 academic year. Some groups of children may need additional help and support to ensure they achieve their potential. Children identified with special educational needs and disabilities, also known as SEND, are provided with extra help at school. Some receive SEND support, which is usually given in a mainstream setting. Those with more complex needs will have an education, health and care plan, which may include attending a special school. 18% of the school population in Wakefield have identified SEND, and there is an increasing trend, similar to seen nationally. Children in need of services receive extra support from social workers and other professionals. They are at higher risk of poorer health, education and well-being outcomes. Such children may be subject to a child protection plan to protect them from harm, or being care provided by the local authority. Rates of children in these groups are lower in Wakefield when compared to other similar local authorities across England. Neurodiversity regards differences in brain function that are part of normal variation in behavioural traits across the population. It is estimated up to 10% of the population may be neurodiverse, and some children with neurodiversity will be able to manage everyday life with little or no support, but others may need help every day. We are just beginning to get a picture of how many people across the district are neurodiverse. This includes through GP record, which is likely to be an underestimate. Girls are less likely to be diagnosed than boys, possibly due to differences in the way neurodiversity presents itself. Health protection includes protecting children from infectious diseases and environmental hazards. Vaccinations are critical to help against potentially life-threatening diseases. Having a high percentage of the population vaccinated is essential to stop disease spreading. Coverage across Wakefield District is generally high, and above the England level for all childhood vaccinations. However, some population groups have lower coverage than others. The overall percentage of children who are vaccinated has seen a drop in recent years. That is the end of the summary of the Children's JSNA annual report. Thank you.